Hello, people of the internet. My name is JD Shadow. We're going to talk about Twitter here, and it's because they have rolled out a new rule about the pandemic and how it's going to label quote-unquote misinformation. I put those in quotes because of something I will talk about here in a few seconds. Because they are deciding that they're going to label misinformation on COVID-19 vaccines and COVID-19 as a whole. If you remember, in December of 2020, they started to remove a lot of tweets relating to what they feel is misinformation. I will talk about that in just a moment because it has something to do with what we found out on the Twitter blog on March the 1st. That was yesterday as of the time of recording this. It's saying updates to our work on COVID-19 vaccine misinformation by Twitter safety. Quote, as the distribution of COVID-19 vaccines expands, people continue to turn to Twitter to discuss what's happening and find the latest authoritative public health information. Not sure who's turning to Twitter for that, but whatever. In December, we shared updates on our work to protect the public conversation surrounding COVID-19. Starting today, we will begin applying labels to tweets that may contain misleading information about COVID-19 vaccines, in addition to our continued efforts to remove the most harmful COVID-19 misleading information from the service. Since introducing our COVID-19 guidance, we have removed more than 8,400 tweets and challenged 11.5 million accounts worldwide. That's kind of a problem when you think about that. We are also introducing a strike system that will determine when further enforcement action is necessary. We believe the strike system will help to educate the public on our policies and further reduce the spread of potentially harmful and misleading information on Twitter, particularly for repeated moderate and high severity violations of our rules. Now, before we go to what they consider as misleading information, let's go to this strike system, because it's not a 3 strikes and you're out scenario, it's a 5 strikes and you're completely out scenario. Labels will first be applied to our team members when they determine content violates our policy. Those assessments will be used to further inform our automated tools and to advance our proactive capacity to identify and label similar content across the service. Our goal is to eventually use both automated, oh good lord, and human review to address content that violates our COVID-19 vaccine misinformation rules. Machine using and automated language processing takes time to be effective. Just ask YouTube how effective it is. As such, we will begin with English language content first and use the same process as we work to expand to other languages and cultural contexts over time. Labels will appear in your set display language, yada yada yada. Our goal with these product interventions is to provide people with additional context and authoritative information about COVID. Through the use of our strike system, we hope to educate people on why certain content breaks our rules, so they have the opportunity to further consider their behavior and their impact on the public conversation. The strike system is similar to our recent update to civic integrity policy. An individual will be notified. Repeated violations will have stricter and more severe penalties on them. Here's the strike system in place, saying 1 strike is no account level activation, 2 strikes you'll get a 12-hour lock, and 3 will get the same thing. 4 is going to give you a 7-day lock, and if you get 5 or more strikes, you are deleted, you are ban-hammered. As always, if you believe that your account was locked or suspended in error, you can submit an appeal. We'll probably just give you a middle finger because we think we are always correct, apparently. This goes on about partnerships, and it lists the people who they are partnered with, apparently to get the right information. However, in this whole thing about partnerships, it does bring into the discussion that they themselves are encouraging people to do things with the hashtag stay home, wash hands, and wear a mask. Now, if you go on to the actual misleading information policy, here's where the problem starts. And it goes in what's in violation of this policy. In order to content related to COVID-19 to be labeled or removed under the policy, policy, it must advance a claim of fact expressed in definitive terms, be demonstrably false or misleading based on widely available authoritative sources, and be likely to impact public safety or cause serious harm. And this policy goes on to address 5 categories: false or misleading information about the nature of the virus, transmission of the virus, such as false claims about asymptomatic spread, or false information about how it is transmitted indoors. Susceptibility to the virus, for example, claims that specific groups or people are more or less prone to be infected or to develop adverse symptoms on the basis of their nationality or religion. Symptoms commonly associated with the virus, for example, misleading instructions on how to self-diagnose, the pandemic or COVID-19 vaccines that invoke a deliberate conspiracy by malicious and or powerful forces. Second one is false or misleading information about the efficacy and or safety of preventive measures, treatments, or other precautions to mitigate or treat the disease. They will label or remove false and misleading information about the safety or efficacy of treatments or preventive measures that are not approved by health authorities or that are approved by health authorities but not safe to administer from home, sale or facilitation of medicines or drugs that require a prescription or a physician consultation, adverse impacts or effects of receiving vaccinations, where these claims have been widely debunked, vaccines and vaccination programs which suggest that COVID vaccinations are part of a deliberate or intentional attempt to cause harm or control populations. Now, these next 2 are really problematic, as if the ones up above were not enough. Then it gets to some things that are really problematic. False or misleading information about official regulations, restrictions, or exemptions pertaining to health advisories. And they'll label these things: personal protective equipment, PPE, such as claims about the efficacy and safety of face masks to reduce viral spread, preventive measures such as hand washing, proper hygiene or sanitation methods, or social distancing, local or national advisories or mandates pertaining to curfews, lockdowns, travel restrictions, quarantine protocols, inoculations, including exemptions from such advisories or mandates, how vaccines are developed, tested, approved by official health agencies, as well as information about government recommendations. Whoo boy, that causes a bit of concern. And false or misleading information about the prevalence of the virus or risk or infection of death, and they'll label the prevalence of the virus or the disease, such as information pertaining to test results, hospitalizations, or mortality rates, the capacity of the public health system to cope with the crisis, for example, false information about the availability of PPE, ventilators, or doctors, or about hospital capacity, and research findings such as misrepresentation of or unsubstantiated conclusions about statistical data used to advance a specific narrative that diminishes the significance of the disease. The last one might be problematic, but I'm not quite sure if anybody's actually doing this, basically saying don't pose as someone who is an expert when you really are not. That is problematic too, but not on the level of the other stuff is. Because one of the main problems we always talk about when we talk about what they're going to consider misinformation is you have to actually tell us what the misinformation you're considering actually is. What do you consider misinformation? What do you consider to be something that is not factually accurate? And of course they're saying, what is accurate? What are we going to look for? And this whole thing, yes, it is telling you what we're going to look for, what we're going to search for. However, it is also saying what their position is on the matter. And yeah, they're kind of disclosing it to a certain degree. However, what we have seen lately and what we have seen during this last year or so of the pandemic is the notion that people are getting absolutely mad about how the health leaders are promoting things that might not actually work or might not actually be effective. The face masks are a completely hot topic, and to the effect that people are going after each other's throats physically over whether or not you're wearing one and whether or not they are effective. The lockdowns are a completely debated subject, and it has to do with how mental health is affected and how some people just don't care that mental health is affected. And they're saying that it's not as bad as getting the disease. that mental health and stability affected by the lockdowns are not as important as a disease that might have a high survivability rate. We still don't know about asymptomatic cases. We don't have a definitive answer on that. Not to mention that this is not understanding how studies can also be flawed and can also be misunderstood and misinterpreted, and also be comprised of samples that are not reflective of the picture as a whole, and going off of a small sample size, and a sample size that is not representative or shouldn't be representative of something as a whole in order to come up with a picture of the situation as a whole. In other words, a degree of either confirmation bias or just a flawed sense of what they're doing. Of course, this could be true of the counter studies as well, but why is one group of studies completely factual correct and can never be questioned, while the other counter studies can be questioned into oblivion and completely seen as misinformation? It is a double standard if there ever was one. We see in places like the Lancet, who have turned around and said that they are calling for evaluations of COVID-19 control measures and saying that lockdowns should be ended, citing several studies and saying that they cause substantial collateral health damage. But as reported on another subreddit, this same study, the same article was posted on the quote-unquote official coronavirus subreddit, and they got subsequently banned for it, for literally posting it. The moderators there are prone to delete and to say that something is misinformation if it doesn't match up exactly to what they believe are the right methods to control, quote-unquote, control the virus. We've seen this time and time again, that qualified studies are being suppressed by these people who are using the pandemic, who are using the virus as a political weapon. And no, I'm not excusing the right wing for doing this either. I'm not excusing any side of the political spectrum for doing this, whether it be right, left, or somewhere in between. You can't do this. You just can't suppress these types of studies just because it doesn't fit along with the narrative you want to push. And that is extremely dangerous, especially when we're seeing now that some people are turning on their health leaders. They're turning on the CDC and the World Health Organization and some people in the media because they're feeling as though they are being told more doom and gloom, that the worst is yet to come, even when they're seeing things to the contrary, that cases are going down as a direct result of the vaccine. They are seeing cases, or have seen cases, go up despite the fact that many people were complying with mask mandates. That is contradictory to what they're being told, and they want answers. They want actual discussion. They want actual debate, and they feel like they're not getting it. And now they're seeing that perhaps the media and some people in the big tech organizations are wanting this to continue because they have not seen numbers of approvability quite like this. They have never seen them being needed as much as they are right now. Not as praised, not as used as they are now. Of course, Amazon being one of the biggest ones, they are being used more than anyone could have ever thought. News media is, of course, sensationalist. They are going to continue to push this. They are going to continue to give you sensational headlines. So how should we trust them? Why should we trust them? In order to give us accurate information. And science should be debated. Not because we don't trust it, but because that is just how science works. Solutions should be debated. And there have been doubts as to whether or not some cases that were listed as COVID are actually COVID. There have been doubts about that. So should we just say to shut up and just believe what people are telling us, or should we be absolutely certain on that? No matter what your position is on that, the fact of the matter is that you should not suppress that kind of information just because it doesn't fit into your narrative. And that's what Twitter is doing here. They are not saying that this is misinformation because it is factually untrue. They're saying it's misinformation because we don't agree with it. It doesn't fit into what our narrative is. Because again, Twitter is a big tech company. They are dependent on you staying at home. They're dependent on you not going out of your house. They're dependent on you to be fearful of the virus in order to continue to use their service, even though Twitter is used by people on mobile devices, so I'm not quite sure where that's coming from actually. But remember some of the other things Twitter has done. Look at some of the other things Twitter has not answered to. The idea of them promoting third-party block lists, which allows a person to block several people without the person being blocked even knowing the person even exists, for reasons of which they didn't even know or even cross their minds that they even were, or were even assumed to be according to the person who made the block list or the person that is using it. And there is no limit to the amount of people that you can block on a given basis at any one time. And there are some people who don't even know they're even on these lists, and there are people who can't get off of them to this day despite several attempts in order to get off of it because they are convinced that they are not what these people are saying they are. A limit to how many people you can block at any one time, a limit to how many people you can block at any one time would solve so many issues that Twitter has right now, but they are refusing to do that because they believe more in people shutting down discussion using that method, shutting down ideological opinions using that method, instead of using it for what it's supposed to be used for in order to prevent harassers and vitriolic people from getting into your feed. And for the record, I'm not saying that if people are telling people to drink bleach in order to survive the pandemic would be misinformation. I'm not saying that that isn't and that should be labeled, or the media actually is right about the amount of people who are actually still posting about this 5G thing and the Bill Gates thing, which they keep running to whenever this sort of thing is brought up, this misinformation quote unquote thing is brought up. They keep bringing that one up as if anybody's still saying that at all. And I guess people are still saying it because the media keeps going to it. But if there's anybody who is still saying that, then of course it should be debunked. It should be labeled misinformation, even though I don't think anybody's still saying that or even saying that to begin with. But again, what we're seeing with what Twitter is saying they're considering misinformation is akin to how the coronavirus subreddit moderators and administrators are calling misinformation anything that does not fit their agenda, even though that coronavirus subreddit is now seeing people turning on their health officials and the CDC because they're seeing data that's contradictory to what they're being told by cable news outlets and blogs and those people who are dependent on people staying home in order to inflate their bottom line. Again, the majority of people who left Tumblr when Tumblr went down are now on Twitter, as we have seen. And these are authoritarian methods. They're authoritarian. They should not be implemented. If Twitter wants to decrease misinformation, okay, that much is good if they would keep it to where it's truly harmful, like the drinking bleach thing, which I'm not quite sure if Trump actually said, and I'm not a Trump fan, but I don't know if he actually said that. But to say that we can't dispute the effectiveness of masks, that we can't dispute the issues involving lockdowns because they have taken an authoritarian position on the matter, and they say these are the experts we're going to believe, and any expert that says otherwise we are going to label misinformation and we are going to strike you for even considering posting it onto your Twitter feed. And if you are a left-wing person like myself, if you are a person, and no, we should not have to tell people we are left-wing because it should be quite obvious we are. I don't know why we have to continue telling people time and time again that we are not right-wing, because people keep trying to label anybody who is to the slightest right of them right-wing. I don't know why people keep thinking that, but here we are anyway. But if you are left-wing and you want to find a place that you can actually debate such topics as mass effectiveness and lockdowns, there are places you can go on the internet where you can debate these kinds of topics, where you can actually have discussion about these topics and not be labeled as misinforming the public like this. The Lockdown Critical Left subreddit is an excellent place for people who actually talk about these topics without fear of being labeled. This is an attempt of big tech to try to hang on to whatever they have left of this pandemic. Because if things keep going the way they are right now, they're saying we might be out of this by Memorial Day, if not sooner. We have several vaccines now. We have vaccines which, by the way, are being told that they can handle the millions of variations that people are saying are out there right now, and saying they're coming and there's really nothing we could do about it. We have to prepare right now. We shouldn't be opening back up in any sort of way right now. Think about how they're suddenly saying that these variations are just suddenly appearing right now. And yes, there are issues about the vaccine, about the rollout, about who is allowed to get it first. And if you question them in any sort of way, you get shamed, you get labeled, saying, oh, wait your turn until we get it first. When is it their turn? In Ohio, for instance, funeral directors are getting it before people who are working in the food industry, who are working with tens of thousands of people daily, before grocery store workers, before restaurant employees, who are helping to be able to keep food on the table and food in your stomachs. How many people are going to come into contact with funeral directors daily? At least versus how many people work in the restaurant or food industry, whether in the grocery store or a fast food place, or a waiter, or somebody who's packing food in a plant. There are lingering questions about how safe are the vaccines. Of course, those are being answered now, but when we were asking them, we weren't allowed to ask. And that's been the main problem from the very beginning. We weren't allowed to ask those questions. We were being told to just shut up and wear the mask. We were being told to just shut up and stay inside. That's what we were being told. And you notice they have to affix a profane word in there with it. Just wear the goddamn mask, or just stay inside, you idiot. That is what we were being told. But now that the narrative is shifting a bit, and now people are saying, wait a minute, maybe we were wrong on this. Big Tech is trying to control the message now. If you notice, Twitter did not do this when people were in agreement that they should stay inside or wear a mask or whatever. But now that people are starting to think, wait a minute, is the worst of it behind us now? And now they're saying, hey, we should be going back outside. Big Tech is getting a little worried that they're going to lose their grip on what they had 1 year ago. And Twitter should not be worried about that, because people use Twitter on mobile devices. They can go outside and still use Twitter. So I'm not quite sure what Twitter is trying to do here. But this is the controlling of information that is being presented to you. This is controlling of information. Should you believe all of it? Maybe not. Should you believe some of it? Probably. But you have the right to at least be told about it. You should have the right to make up your own mind about it. And if there are conflicting findings, then we should hear all sides of the scientific debate. We should not just say that one side has all the answers and the other side of the scientific debate doesn't have any answers whatsoever, and is just misinforming you and is politically motivated. Why is one side politically motivated and the other side is completely factual in your mind? And will this video, the one that you're watching right now, will this be labeled misinformation under this new rule? Will this be labeled as factually inaccurate? Will this get me a strike as well? If it is, then it is telling you just where exactly Twitter is standing right now. And plus, so-called reputable news sources such as the Washington Post and CNN can have misleading headlines when compared to what somebody has actually said. For instance, Dr. Fauci actually said that we could be wearing masks up until 2022, and there's some questions that he might want to answer to as well. Some counter questions, some follow-up questions that he's never asked. But the way that CNN and some other news organizations has headlined this, that there was no question about it, that it was no doubt about it. Is that going to be called misinformation as well? Or is Twitter employing a double standard and just playing favorites as to who they're going to allow in and who they're not? Remember, Twitter is a private organization, but they might hold a sort of monopoly when it comes to social media and the type of social media experience that they provide. And when you look at how Parler was treated right after the Capitol riots and how they used that as a weapon to silence a competitor, you can obviously see where Twitter is going with this. They can control what the flow of information actually is, regardless of whether or not you would agree with it or not. You are free to agree or disagree with whatever you see. The problem is that if you're not allowed to even see what the information is of what an article actually provides for you, then you're not allowed to even make that decision. And if you are not allowed to see a particular side of the argument, regardless of whether or not it's a scientific discussion or something more political, then you are not allowed to make an informed decision based upon what you're seeing, because you're only seeing one side of a story that might have different facets, or maybe a shade of gray or several shades of gray, in which you're only seeing the black and white of a particular discussion. And in the era of clickbaity headlines coming from reputable news sources, because they can't compete with the likes of YouTube and the people who don't have a middleman and don't have corporate entities who are telling them what to write and what to not write, and what they're allowed to report on and what they're not allowed to report on, is more important than ever for these social media outlets to provide you with all sides of the discussion and let you be able to make up your own mind as to what is your take on that particular subject, especially and even with a subject about science such as this. In the end, this is not Twitter saying that we're trying to keep you from information that might actually harm you if you follow it. This is Twitter saying we have all the power, we have all the flow of information, and we can dictate who is allowed to tell you what they are trying to tell you, regardless of whether or not it's misleading or not, or whether or not the article is clickbaity or not. And anybody who's telling you something that might actually hurt our bottom line will never be allowed to grace your timeline. And of course, look for the usual suspects, both in the media and on YouTube. I'm talking about you, the Young Turks, to praise this decision, even though Young Turks is usually one that should call something like this out. Shows you how much of a fall from grace the Young Turks have been in recent years. I'm saying this because I would be quite surprised if they went the other way, given their history in recent years. But what do you think about these new rules and about Twitter's new stance apparently on the subject? Leave a comment down below, and be sure to subscribe for more geek gaming culture and culture altogether. And be sure to ring the bell to be notified about latest content. I'm going to try to upload a little bit more often now. That is, unless this is labeled as misinformation, and if it is, then, well, we'll know where everybody stands. I'm JD Shadow, that just happened.